Good afternoon. Good afternoon. Good evening. Good morning. Anywhere you're hearing me from. I'm Dr. Kwame Eric Olubenga. And our today's lecture supposes to be 2-in-1. We want to talk on endometriosis and breast. But for today, we will limit our discussion on endometriosis. Endometriosis. What do we call endometriosis? Where or which among female or male this thing do affect? I want to tell you categorically it happens to female. The gender is female. And what is endometriosis? It's an often painful disorder in which tissue similar to the tissue that normally line the inside of uterus is a tissue that is similar to the tissue that is inside of uterus. They are similar tissues, but that tissue of it is not good for the body. It's not good for the system. It's not good for human body. As you progress, you see what I'm trying to say. Endometriosis is a disorder. It's not part of the system. It's a disorder, complete disorder to the system. It is similar tissue, very similar to the tissue in the uterus. It is most commonly involved in ovaries. It's only common in ovaries, in the fallopian tube, and the tissue lining in pelvic. Do you see how dangerous it is? You see it at ovaries, you see it at fallopian tube, at the same tissue that is lining in pelvic. What are the signs of endometriosis in female gender? What are the signs? The signs that indicate that somebody, a female, is having endometriosis. The symptoms are there will be diarrhea or constipation during monthly menstrual period. The patient will complain of diarrhea or constipation during our monthly menstrual period. 2, there is heavy flow, unusual flow of menses or cause of bring about irregular menstruation in that woman. They bring about irregular menstruation or heavy flow of monthly period. You know, there is pain. If we're doing our urination, there is always pain. Pain. You'll be feeling pain during our monthly menstruation. When you want to urinate, note that when you want to urinate during a menstruation, you will not be feeling that pain as regular every day. But when he's doing a menstruation, whenever she wants to urinate, she will feel that pain. One, and you have the bowel, and there will be movement at the bowel during a menstruation period. The bleeding between menstruation period, there will be bleeding between menstrual period. Maybe there will be heavy bleeding today, tomorrow it goes, next week it goes. That's how we'll be experiencing it. How do we know as a practitioner that a woman is having endometriosis? The only way we can know is one, note it. The only how we can know is for the woman to go through ultrasound, or you should go for pelvic examination. If you can do a pelvic examination on your own as a practitioner, you can do it. But if you cannot know how the patient to go to lab, let her go and do the test. The test will actually bring out the result of what we want. Therefore, this endometriosis, at the early stage, what are the signs you see? What are the symptoms you bring out? There must be a symptom. For example, the pain in the lower tummy or back pelvic. The pain in the lower belly or back belly. During the period, that period pain that stop one. You know, some ladies have menstrual pain. During their menstruation, they feel some pain. But any menstrual pain that disturb you, that stop a lady from carrying out her normal activities, her monthly activities, that lady should understand that she has a problem called endometriosis in her system. When you have pain during and after sex is meant for enjoyment, it's meant for reproduction, and maybe you have sex now, you now start feeling terrible pain during the sex and after sex is a symptom. When you are now peeing, when you are peeing or you are pooping and you are experiencing pain as a lady, you know that you are having endometriosis. When you feel sick during menstruation, you have diarrhea, you have constipation, or you have blood, you saw some traces of blood in your pee or your pooping, try as much as possible to know that you have endometriosis. Other advanced, that's an early stage. In the advanced stage of endometriosis, other signs are painful menstruation. The menstruation will, throughout the menstruation, will be so painful, so terrible. When you are having sex intercourse, the pain will be so terrible. The movement at the bowel will be so heavy. When you are that bowel movement will be so heavy when you are urinating. You now have excessive bleeding. Therefore, you know that. But the major one that concerns me is that it causes infertility. That's the most dangerous aspect of it. That it causes infertility. That you now discover that marriage of 10-15 years just because of endometriosis, there will not be fruit of the womb. That's the marriage. That's the reason why you have to look into it. As a practitioner, is a thing you must know. You must know the difference between endometriosis, fibroid, ovarian cysts. We must be able to indicate the difference, because ovarian cysts will not cause infertility. Fibroid can only cause infertility if it is within the uterus. But the other one that is out of the womb by the side, that one cannot cause infertility. You understand? The one at the uterus, the fibroid that is the uterus will cause infertility. You now imagine endometriosis. The reason why endometriosis causes infertility, because it's in the ovary, it's in the womb, it's in the tube, or fallopian tube. You understand? Therefore, you will see that's the reason why it causes problem, because fallopian tube is the passage where the egg will move to where it's supposed to be after the egg has been fertilized. Therefore, those are barriers that cause infertility in women. Then how do we treat endometriosis locally? One, you can use hot water to massage the lower belly part of the belly. Hot water, always do it. Therefore, it will be shrinking. When you do that on daily basis, it will be shrinking. Two, you get them anti-inflammatory herb. That is what we are going to discuss at the practical. Anti-inflammatory herb, I will show you, and all the herb that is involved. I will show you in the practical the name of those herbs that will call it in Yoruba and English. I will show you in the practical. Having said that, massaging, you know, those women, they know how to, when they massage the womb, they massage the endometrium will be shrinking. And we can use the natural progesterone cream, in which I will indicate in the practical in my video that you will see. And let the patient get used to walnut. Walnut also shrink it. Walnut, when the patient, let her be taking walnut often. When you take walnut often,